This is a clinical pathology case number 2, where I am going to tell you about a 30-year-old female with ovarian mass, and gross and microscopic features are shown here, and you have to tell about the findings, diagnosis and its clinical significance. So what are these gross findings? First I will show you. Actually, this is a case of benign cystic teratoma, which is the benign teratoma, and these benign cystic teratomas are also known as dermoid cyst, right? Because they are cystic in appearance. Sometimes you will see there is a protuberance, there is a ridge, or there is a elevation over the surface of the mass, and this elevation which you are seeing here right now is called as rocky tansky protuberance. So rocky tansky protuberance, what they contain when you will cut them, so you can see on cut section, this is the cut section appearance, this is the external surface, right? This is the cystic teratoma mass, and this one is rocky tansky protuberance. And when you are cutting this area, you can see underlying hairs are there. You can notice there are tooth, and there can be cartilage and other structures are also. So that is what they are showing you, various level of differentiation. So what we will do the next, we will take out the section from these areas. Why we are taking, we want to see what are the structures may be. So in this microscopy you can see, you can notice cartilages are there. This blue area is areas of the cartilages. Then you can notice smooth muscles are there. You can see these are the group of clear cells, which are the fat cells. And you can also notice there are wavy nerve fibers, and these are the glands, right? So these are the glandular structure, and you can see there is a mucinous columnar lining is there, and these are the salivary glands. You can notice that salivary glands are also present here. So that is how you can see the nature of differentiation of from various germ cell layers in case of teratoma. So why we are calling this as a benign cystic teratoma? Because they are having cyst, they will be mostly benign. What is the clinical significance of this rocky tansky protuberance? That is what I wanted to tell you. So rocky tansky protuberance clinical significance is increased risk of malignant transformation, right? And which malignancy will be most commonly associated? So most commonly is squamous cell carcinoma, right? So just one overview about this. This was a benign cystic teratoma. Benign cystic teratoma is also called as mature teratoma or dermoid cyst. What they will be consisting of? They will be consisting of hair, keratin and cartilage. They are most commonly benign. Rocky tansky protuberance will be consisting of hair, bone and cartilages. And the clinical most important thing, why I am interested, why examiner interested in rocky tansky protuberance? Because they have a high risk of malignant transformation. So which malignant transformation is having more common? So answer will be squamous cell carcinoma. So keep learning and keep enjoying this CPC number 2. Next will be CPC number 3. Best wishes till now. Till then, bye bye.